Welcome back in. We are spreading awareness here at 4 on colorectal cancer. It is now the leading cause of cancer deaths among people younger than 50 in the United States. We are joined by Dr. Jennifer Pierce, a colon and rectal surgeon at Promedica, to help us figure out some prevention methods. Thanks for being here today.
Thank you for having me.
Yeah, I think recently this has been top of mind because we've been hearing about famous folks. James Van Der Beek, the actor, just passed away a couple weeks ago. We saw Chadwick Boseman a number of years ago. These guys were 43, 48, under 50 years old, and they're
it's
young.
devastating.
So we are kind of seeing that trend, aren't we, in these younger cases?
Yeah, it's pretty alarming. The incidence is rising about 2% per year. To kind of put some numbers to it, for people who are born in the 1990s, as compared to those born in the 1960s, they have 5 times the risk of getting early onset colon cancer. So we're really seeing like a birth cohort effect.
Wow. Do we know why?
I think it's a complicated milieu of factors that aren't completely understood. While some early onset colon cancer can be genetically inherited, the vast majority we're seeing, we think, is related to probably environmental and dietary factors and things that affect people early in life.
We're seeing, we've been dealing with for a number of decades this ultra processed food that has really just become part of our everyday lives. And now I think we're starting to identify that and recognize that. Now we're going to try to turn things around. But in the meantime, what should people look for in terms of symptoms? Because if I'm a 40-year-old guy, probably, or woman, I'm probably not thinking I might have colon or colorectal cancer.
And James Van Der Beek was like stage 3,
right.
I believe, at his diagnosis. Yeah, unfortunately, young people are being caught at later stages, we think, because they are ignoring some of those signs, potentially. But number 1 is rectal bleeding, not normal abdominal pain, and then any change in bowel habits. So if you have new sudden onset constipation, all those are reasons to get a colonoscopy sooner than later.
Yeah, I know it's things that we don't really want to talk about, but it's normal. It's natural. It's part of our lives.
Absolutely.
So really just start paying attention to what is not normal.
And listen to your body, because I heard so many patient stories of like, I did tell my doctors, but because I was this age, like no one thought to look into it.
Yeah. So when should we start screening? Because a colonoscopy would be the way to screen for these cancers, right? But what age would we think about starting to do that?
So screening starts at age 45 based on current guidelines. That being said, if you have a first family relative, an underlying GI illness, inflammatory bowel disease, there's indications for screening earlier than that. But starting at age 45 is the new age. Colonoscopy is still the gold standard screening. It is nice in that, in addition to identifying cancer and diagnosing it, it can also identify precancerous lesions that can be removed at the same time and prevent future risk.
You can find all those little polyps in there, take them out, get them checked, make sure that everything is kosher there. But a lot of people are going, I don't want to deal with the prep, but you know what? You get through it, and you'll be thankful that you did, right?
Yes,
when you
absolutely.
can catch these things, because as we said, catching early is the key here, and that's been an issue with these younger cases. We're not thinking about it, but maybe we should be thinking about it more now, right?
Definitely.
So want to get with your GP or your primary care physician first to start discussing these things. Where do you start with that?
Yeah, any PCP can direct you to getting a direct line of referral to either colorectal surgeon or a GI doctor. They both perform colonoscopies.
So there's some information on your screen. Promedica Physicians, the colorectal surgery department there. But if something isn't right, if you pay attention to your body, as you said, you know what's normal for you, and things are starting to not be right. And as you said, that rectal bleeding too, in the stool, things like that, not a good thing. You want to look into that, right?
Yeah.
Doctor, thanks for being here.
Thanks
today.
so much.
We appreciate it. Yep.